Let's talk about professionalism, caring for families. So maternity and pediatric nursing. Obviously, maternity is extremely vulnerable time of life. In pediatrics, you're caring for two. So you're caring for the patient, but parents are obviously heavily involved because these are kids that we're taking care of. For maternity, you are also taking care of two patients, the mom and the baby or fetus or whatever stage of pregnancy they're in. With pediatrics, children feel vulnerable. So we will talk about developmental theories, developmental changes that occur throughout the lifespan or the child development that we will review and go over because these are important to implement when you're caring for children. Depending on their age, you will employ different developmental theories, developmental tasks. It'll help you also understand if this child is coping, if they're on track for where they should be for their age, that kind of thing. So, they're depending on the age, healthcare providers are scary a lot of times. So keeping that in mind. Parents also feel vulnerable. Having sick child or getting child or a child getting shots is terrifying. So parents being involved is something you'll have to get used to for pediatric. So, sorry, hold on, let me go back. There. So caring for families. Review this in your book, Caring for the Families. I have the page numbers right there. So family is incredibly difficult to define. There's lots of different types of families, lots of considerations for nurse caring for a childbearing or child rearing family. So again, we're talking about the family as a unit now and the community at large. So in the face of stressful situations and challenging people, what can the nurse do? So professional behavior, this is so important, especially in this area. Again, we're talking about vulnerable children, babies, and parents that are scared as well. So please be on your best behavior. Keep what they're going through in mind and work with the nurse that you're following, of course, but please be professional. Provide appropriate reactions. So when you're on some of the units like labor and delivery or NICU, you will see some things maybe that you have never seen, that's shocking, that's maybe scary, emergent, that type of thing. Please make sure that you're still reacting appropriately and professionally. I always call it put your nurse face on. So you might be feeling one way, but please don't let it show in a way that's going to scare the family or the patient. Instill confidence for the family. They see a nurse that's confident, that's not too emotional, that is answering questions, that's competent. They're going to feel safe. They're going to feel better, and it helps quite a bit. So listen actively, always be honest, and be kind. I feel like that is a given. So observation days. So a lot of this is how we expect you to behave during clinicals and what to expect. So a lot of your clinical time is observation. So when you're on labor and delivery and you're on NICU, if you go to maternal fetal health, which is the Dr. Landwehr's office in the hospital, the breast care center, and some other baby clinicals, these are observations. Don't touch the patient. Don't overstep boundaries. Don't ask inappropriate questions. Please do not have your cell phones out. And no sitting unless your nurse is sitting. Please do not leave early, and you will have 30-minute lunches. You cannot leave the campus when you have your lunch break either. You have to stay in the hospital. So please don't leave early. And I can tell you We will find out if you're leaving early. Now, if it's really not busy, there's not much going on, maybe on labor and delivery or mother baby, there just doesn't happen to be a lot of patients. That does happen occasionally. And if your nurse says, there's really nothing to do, you can go, that's different. And if that happens, just let me know. I won't hold that against you because you can't help that. But otherwise, if there are lots of things to do, there are patients, and your nurse doesn't say you can go, but you leave early, I will find out. So please do not do that. We want to get your full clinical hours, clinical experience. Um, so observation day check-ins, you'll need to check in with your clinical instructor when arriving to and leaving from your designated unit. So if you're going to labor and delivery first, check in with the instructor that's on mother baby. So on Mondays, that will be Kylie, and on Fridays, that will be me. Um, and then, I'm sorry, I haven't updated the names here. If you're going to NICU, same thing. So because we are doing our pediatric clinical on campus and we're doing the virtual like the VR sim for those um, on the campus. So if you're going to labor and delivery or NICU, just check in again with either Kylie on Mondays or me on Fridays. Remember, you're representing Ivy Tech, like I said. Nurses and staff on the units are also observing you, and they will notice behavioral issues and they will tell me. It will be reported back, and we will address it accordingly depending on the severity and what happened. Um, Also, huge, 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 do not violate HIPAA. They will, if you're looking at your own medical record, a family's medical record when you are in Cerner, if you can get in Cerner, um, or any patient that you are not directly taking care of, they will flag it and it is considered a HIPAA violation. Even if you think it's real quick, nobody will notice, they will. And this has happened on many occasions where students do that and then they are they get disciplined or they're no longer allowed to do clinicals at IU Health. Um, so no HIPAA violations, please. And please don't take pictures ever. Unethical patient care practices or any other safety concerns will be taken seriously. So I know that sounded like scary, a lot of things. Usually I don't have a problem with students and I don't anticipate that happening, but I just thought it would be important for us to review that so that you know how to behave, what's expected, and it'll make it for a smoother term. Again, we'll go over this in class if you have any additional questions that I didn't cover. And that's it.